Hello and welcome. I'm Dr. Robert Singer, Director of Neurovascular Therapeutics in the section of Neurosurgery at Dartmouth-Hitchcock Medical Center, and on behalf of Dr. Cliff Eskey and our entire team, I want to welcome you to this module on carotid stenosis. It's our hope that the following information will be helpful to you in understanding your care. You'll have plenty of time to discuss questions during your virtual visit. What is carotid stenosis? Carotid stenosis is a narrowing or constriction of the carotid artery. Most commonly, this occurs in the neck, but can also take place in brain blood vessels or other arteries that irrigate the brain. The plaque can be stable and asymptomatic, or it can be a source of embolization. Emboli break off from the plaque and travel through the circulation to blood vessels in the brain. As the vessels get smaller, the emboli can lodge in the vessel and restrict blood flow. This ischemia can be either temporary, yielding a transient ischemic attack, or permanent, resulting in a thromboembolic stroke. There are many risk factors for carotid artery disease. They include age, smoking, hypertension, or high blood pressure. This is the most important treatable risk factor for stroke. Abnormal lipids or high cholesterol, a diet high in saturated fats, insulin resistance, diabetes, obesity, sedentary lifestyle, or a family history of diseases of the coronary arteries or carotid. Symptoms associated with carotid narrowing can include sudden loss of vision, blurred vision, or difficulty in seeing out of one or both eyes, weakness, tingling, or numbness on one side of the face, one side of the body, or in one arm or leg, sudden difficulty in walking, loss of balance or lack of coordination, sudden dizziness, difficulty speaking or swallowing, confusion, memory problems, and sudden severe headache. Testing for carotid disease includes auscultation or listening with the stethoscope for a bruit, carotid ultrasound as seen in the bottom left, an MRA, a CTA which is seen in the bottom right, or the gold standard in the middle, cerebral angiography. These two images demonstrate a cerebral angiogram on the left and a CT angiogram on the right. Both images demonstrate very tight narrowing in the internal carotid segments. Whether you undergo an operation or not, lifestyle modification is in order when diagnosed with carotid stenosis. Common lifestyle modifications can include quitting smoking, controlling blood pressure, controlling diabetes, checking and treating cholesterol as appropriate, dietary modifications, a healthy weight, exercise at least 30 minutes a day, most days of the week, and limiting alcohol to 1 drink per day for women and 2 for men. The decision to treat carotid stenosis is based on the degree of narrowing, whether the patient is symptomatic or asymptomatic, health, patient age, and personal preference, and finally the overall endovascular or surgical risks. These factors will be discussed with you during your visit. In general, patients without symptoms but with carotid stenosis will be offered procedures if their narrowing is greater than 60%. The data from many studies indicates that carotid endarterectomy is 3 times as effective as medical therapy alone in reducing incidence of stroke in patients with symptomatic narrowing of 70 to 99%. For patients with greater than 70% narrowing, there's a significant stroke risk reduction with surgery compared to medical management. Patients undergoing carotid endarterectomy or open surgery can expect to be admitted the morning of the procedure. The variable time for the procedure is about 1 to 2 hours. Intraoperative monitoring such as EEG is used when necessary. Patients usually go to the special care unit postoperatively with blood pressure control. The hospitalization is 3 to 5 days, and there's a 2-week follow-up for wound check and questions. Aspirin is continued throughout. This is an illustration of a carotid endarterectomy. The artery is isolated in the neck, it is opened, and the plaque is removed. Patients undergoing carotid stenting can expect to be admitted the morning of surgery, oftentimes being pre-medicated with aspirin and Plavix. The time for this procedure is usually 1 to 2 hours, and again the special care unit is used post-op for monitoring. The blood pressure can be lowered after this procedure depending on the patient's condition, and the hospitalization is oftentimes only overnight. Typically, patients are discharged on aspirin and Plavix with follow-up ultrasounds at 6-month intervals. 2-week clinic follow-up is also offered. This illustration demonstrates the placement of a stent and a balloon to open up the carotid artery and push the plaque away. This is an angiogram demonstrating carotid stenting. The very tight blood vessel on the left can be seen, and then on the right, the wide open blood vessel after angioplasty and stenting. The surgical and endovascular risk factors include bleeding, infection, swallowing problems in the case of surgery, loss of neurologic function due to damage of the brain, stroke, and death. The overall risk profile at Dartmouth-Hitchcock is quite low and well within the accepted standards. Again, thank you for watching this video. We hope that it will help you in your understanding of carotid stenosis and prepare you for your live visit, which will begin shortly. Please feel free to watch other modules and contact us with any questions or feedback.